Hello, this is the Gastrointestinal NCLEX-RN question and answers. The nurse is caring for the client who has a temporary colostomy following surgery for colon cancer. The nurse assesses that the client's colostomy bag is empty and there has been no stool since surgery 24 hours ago. What should the nurse do? Call the surgeon immediately, place the client left sideline, document these findings, give a bulk forming laxative. I like to document these findings because they just had surgery, so it's normal to not have stool for a little bit. And the answer is 3, document the findings. All right, the client is admitted to a hospital for medical management of acute diverticulitis. The nurse should anticipate that this client's plan of care will include which component? Definitely this NPO status. When we're dealing with GI problems, we definitely want them to have rest, okay? Frequent ambulation, that's not resting. Prescribe antibiotics. Anytime there's itis at the end of your disorder, you're going to go ahead and choose the antibiotics, okay? Anti-emetic medications, look at the location of which disorder you have. You have some nausea, vomiting if it's dealing with the stomach, somewhere at the small intestines, somewhat that they're doing in them. But it's 1 and 3. Okay, deep breathing every 2 hours. There's no need for that. The client is hospitalized with large bowel obstruction resulting in massive abdominal distension. This is bad. It can press on the lungs, which assessing findings should be most concerning to the nurse. Your specific gravity value of 1.020. High pitch and tinkling bowel sound. Let me know my bowels are good. Decreased lung sounds in both lung bases. That's a no-no. Airway breathing circulation. Client describes abdominal pain as colicky. Okay, well, we're having obstruction, so it's going to hurt. So that's a normal association with this. All right, next. The nurse is caring for the surgical client during the first interval after abdominal perineal resection, which action should have priority. So in the perineal area down there, abdominal resection, okay. Provide a diet that is low in residue. Get your colostomy bag for stool amount. What is that? No, assess the perineal dressing for drainage. Yeah. Okay, this is where the anus, rectum, and sigmoid colon is removed. So they're going to have a colostomy. So we want to check that. I mean, not a colostomy, but we want to check the dressing for drainage. Make sure there's no infection going on. Case in point, we are dealing with the GI that has normal bacteria that can go bad. Okay, so the answer is assess that bag. All right. The nurse is completing a home visit with a client who has a partial resection of the ileum for Crohn's disease for weeks previously. The nurse should collect additional information when the client makes which statement. My stool flows and seems to have fat in them. Oh, what this means is that the bowel is not being secreted in some way to where fat is not being digested. So the small intestines and large intestines, which are unable to do that with the fat, it just keeps it in the poo, and it makes it float. So they have that the additional information there. I have gained 5 pounds since I left the hospital. That's not too bad. I'm still avoiding milk. You want to avoid milk in Crohn's disease. That what's so good about him gaining 5 pounds is that with Crohn's, all layers of the intestines is destroyed, so absorption is impaired in that area, okay, and which can happen on any part of the GI tract. Okay, I am having only 2 formed stools per day. That's not nothing for me to no. It's 1. Okay. The client with Crohn's disease has undergone a barium enema that shows strictures, which can cause obstruction here, and the ileum. Based on the finding, the nurse should monitor the client closely for which signs of which complication are definitely the obstruction, because those strictures, they fuse together on where they're not supposed to go, And due to inflammation and damage, it can cause a narrowing, and this can lead to obstruction. Obstruction can lead to and paralytic ileus, where it's not working. Okay. The nurses also, excuse me, we're going to go back with the obstruction. Can't get anything down or past. It's going to impair our ability to get our nutrients that we need to survive. All right, next, the nurses review the history and physical of a teenager hospitalized with ulcerative colitis. Based on the diagnosis, which information should the nurse expect to see on this client's health history and physical? Heartburn, vegetation, abdominal pain, and bloody diarrhea. I like that one because we know ulcerative colitis. There's these ulcers that come from our autoimmune system targeting our cells. So it's going to cause the abdominal pain there and blood diarrhea because the area is constantly inflamed. It's not able to function to where it can soak the water from the content. It can't. So 3, weight gain and elevated blood. Okay, not here. Abdominal distension, hypoactive bowel sounds. That's not what's happening in ulcerative colitis. It's just bacteria is inflamed the lining. It's happening on the lining. So it's 2. The healthcare provider writes the following admission orders for the client with possible appendicitis, which order should the nurse question. Place on NPO status, we want that. Any kind of GI problem, we want NPO. No analgesics until diagnosis is confirmed. We need to know what's going on because you don't have any pain. We don't know where to go. Okay. Apply heat to abdomen. Oh, this is a no. We're not going to apply any heat because that increases the chances of it bursting or perforating. That heat causes the vessels to dilate, and they're already hurt and dilated. We don't want it further. So, no. Start IV lactated ringers. We're gonna want that with appendicitis or risk for peritonitis. Also, with appendicitis, they suddenly complain that they have a relief of their pain. This is bad. It's not a good sign. Go ahead, tell the provider this. Okay. The client has diarrhea and refuses to drink the prescribed oral hydration solution, insisting on having chicken broth instead due to cultural beliefs. Which statement best describes the possible reason for the client's request for chicken broth? The chicken broth has yang quality. To better understand the yin and yang is if I'm having something bad, what could help make it good? That's right. That's it. So if he don't want to drink the oral hydration, why would he want to drink the chicken broth? Chicken broth is it's a fluid. It has sodium. It's going to help retain a lot of more fluids. So the answer is 1. Okay. Extra protein chicken broth reduces diarrhea. How you know that? No. The high sodium is anything supposed to be fiber, not protein. The high sodium in the broth is needed to treat diarrhea. It's not needed to treat diarrhea. Okay. Modern just you could be having diarrhea because you're nervous, But the high sodium in the broth is treated. So if I got a lot of sodium, that's going to, a lot of sodium is not good, okay? It's going to suck stuff out of your vessels, okay? We want just the right amount. Modern medicine cannot be trusted. Broth is needed to treat disease. That don't even make sense, but okay. The client has diarrhea that has been cultured. He has C. diff in his diarrhea. To prevent the spread of infection, the nurse should perform which intervention? I shouldn't even have to read all these for y'all to know which one it is. 2. You can't put hand sanitizer when you're dealing with a C. diff patient. They can live a long time on surfaces of stuff. So, vigorous hand washing. The nurse's care for the client diagnosed with cirrhosis. After completing discharge education, the nurse recognizes the need for further teaching when the client makes which statement? My cirrhosis was caused from too much alcohol. I plan to stop drinking. We want them to stop drinking. I need to rest more. I plan on only going to work on a part-time basis. I like that. There's nothing wrong with that because we are GI patients, like in cirrhosis, need to rest. Propranolol has been ordered to decrease my blood pressure. Okay, this is the answer here. Because propranolol is used to help decrease varices when dealing with cirrhosis. So that's what that's used for. For first one, help reduce the amount that is. But propranolol is not used in cirrhosis for blood pressure measures. It's to decrease those varices from popping. The client is admitted with upper right side abdominal pain. The nurse is concerned that the client may have liver cancer when which serum lab test results are in. The answer is going to be that. When you see that protein, the liver is responsible for breaking down all the protein and stuff like that. So that's how I associate that. Phosphorus is dealing with the kidneys, creatinine, the kidneys too, and the CA level with the ovaries. The nurses care for the newly admitted client with acute necrotizing pancreatitis, which interventions, if prescribed, should the nurse implement. So we got peritonitis, pancreatitis, necrotizing, okay, it's going to destroy stuff. We're going to need some fluids, so I like one because we don't want to go into shock. The exudate is exiting out third space into other areas. Initiate nasojejunal intravenously, the low-fat formula. We'll come back to that one. This impenium, that's an antibiotic. We're going to want that anytime there is any inflammation. We're going to want antibiotics. Okay. Up to check. We need them to rest, so we don't want that. Insert a unicardioid. I like that too. Position to the left side of the head to be elevated. No, what is that going to do? Yeah, so anytime we're dealing with a person about to go into shock, the kidneys will be our best indicator because they shut down when things are going wrong. So it says they're drained. So it's 1, 3, and 6. The student nurse is caring for the client following a liver biopsy, which observation nurse care demonstrates to the RN that the student understands the post-procedure care. Takes the client's vitals, signs every hour. Now walks the client 1 hour post-procedure. On the right side, has like cough and deep breathe hourly. This is on the right side. We're going to position the client on the right side to prevent bleeding. Okay. The cough and deep breathe, we just, only thing happened, they just got a small speck of tissue and for testing. Excuse me. Okay. The client recovering from acute pancreatitis who has been NPO asked, when can I start eating again? Which is one of the nurses accurate. We're going to go with 3 because if lipase is still increased, that means that it's going to trigger your pancreas to further damage you. So we want to wait till your pain is controlled and your lipase levels are down. So who thought it was 2? Now that's a good one, but we're talking about our pancreas. Pancreas doesn't have anything to do with gas or our, bowel sounds. Okay. The nurse is preparing to care for the client who just had a Whipple procedure. Whipple is the removal of your biliary area. It's a very major surgery. Okay, what should the nurse include in the immediate plan of care? So they're removing the top part of the pancreas, the gallbladder, and the distal bowel duct that's removed. So what should the nurse include in the immediate plan of care? Monitor blood glucose. I like that one. Initiate internal feedings. No. Initiate no. Remove the epidural line. No. We're going to monitor her blood glucose levels because that top of that pancreas head is gone and is really responsible for helping get it down fast. So watch for that. All right. The nurse is assigned to 4 clients who were diagnosed with gastric ulcers. Which client should be the nurse priority when monitoring for GI bleeds? Okay. Definitely 3, taking aspirin. And, so thin your blood, you can bleed out easily. For your client who's positive for H. pylori, now you might pick that one because, well, H. pylori causes peptic ulcers, but they're not the primary reason for it, okay? There is a secondary cause. Now, primary would be, let's say NSAIDs. But H. pylori, you can have it in your system and still not have an ulcer, okay? If you take an aspirin or NSAIDs, they strip that lining, your mucosal lining out, so making it a primary source for why you having your ulcer because you don't have that protective lining. The 30-year-old pregnant client taking Tylenol, this is not, so it's the aspirin because it's an NSAID. We don't want you taking NSAIDs if it's going to impair that line of protection. Okay. We got 2 on this slide. Let's do 1183. The nurse is caring for the client with acute diverticulitis. Which finding should most prompt the nurse to consider that the client has developed an intestinal perforation? White blood cells elevated. Anytime there's inflammation, white blood cells are going to be elevated. So temperature. So we're trying to look for signs of intestinal perforation where our intestines has bursted open. Bowel sounds are absent. If I can't hear my bowel sounds, that means they're not intact. Reports intense abdominal pain. When we're having diverticulitis, it may be hurting already. Okay. All right. 1184. The nurse is caring for the client who has a temporary colostomy following surgery for colon cancer. The nurse assesses that the client's colostomy bag is empty and that there has been no stool for 24 hours. What should the nurse do? We've already done this one, so let me see what y'all chose. I hope it was 3. Okay. All right. We have 2 on here, so let's do 77. The nurse is completing a home visit with the client who had a partial resection of the ileum for Crohn's disease 4 weeks previously. We did this one already too, so I want to see if y'all got that one right. A nurse should collect additional information when the client makes which statement. I hope y'all chose that one. All right. The second one, the nurse assesses the client previously diagnosed with having an inguinal hernia. The nurse considers the client's hernia may be strangulated when which assessment findings are noted. So we're talking about a hernia that's been strangulated or about to be, it's scroll 2 type. Abdominal distension, I would say that. Dyspnea with exertion. This ain't dealing with my lungs. We have to look at that where it's happening at. Inguina is toward the, growing. Severe abdominal pain, that it might be hurting. No stool for the past week. So I got, should be 1, 3, and 4. Okay. Oh, well, that wraps up our video for our NCLEX questions on GI systems. Thank you. Sorry.